Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
All right, let's jump right in and break down a really critical medical topic, cerebrovascular accidents. You probably know them by their more common name, a stroke. So here's what we're going to cover. We'll start with the basics, what exactly a stroke is. Then we'll get into the two main types, dig into how each one happens, and wrap it all up by connecting that science to the risk factors and the clinical signs you really need to know. Okay, first things first, let's make sure we have a really solid foundational understanding of what's actually going on in the brain during a stroke. At its very core, the problem is a disruption of blood supply. You can think of it like a sudden power outage to a very specific part of the body's main control center. And for brain tissue, which is working nonstop, this is absolutely catastrophic. And here's why that's such a big deal. It's not just about blood, it's about the fuel that the blood is carrying. The brain is incredibly hungry for energy. It uses about 20% of all the oxygen and calories your body takes in. So without that constant supply, its cells start to die in a matter of minutes. So now we know what a stroke is, but how does it actually happen? Well, there are two primary ways, and probably the easiest way to picture it is to think about a problem with the brain's plumbing system. This right here is the single most important distinction you need to grasp. An ischemic stroke is like a clog in a pipe, which starves all the brain tissue downstream. A hemorrhagic stroke, on the other hand, is a burst pipe. This causes damage not just from the lack of blood flow, but also from the bleeding itself, which puts a ton of pressure on the brain. Okay, let's dig into that first type, the ischemic stroke, the clog. This is by far the most common kind, making up the vast majority of all strokes, and it happens in a couple of different ways. So with a thrombotic stroke, the problem develops right there on the spot. Over years, fatty deposits, what we call atherosclerotic plaques, can build up and make an artery narrower. If that plaque becomes unstable, the body tries to fix it by forming a clot, a thrombus, which can end up sealing the vessel off completely. An embolic stroke is a little different. This one's a traveling problem. A clot or some other piece of debris forms somewhere else in the body. A classic example is in the heart during a condition like atrial fibrillation. It then breaks free, travels up through the bloodstream, and eventually gets stuck in a brain artery that's just too narrow for it to pass through. And what's really fascinating here is how the way the stroke starts gives you clues about which type it is. With a thrombotic stroke, that blockage can happen progressively, so the symptoms might come on slowly or even kind of come and go. But an embolic stroke, bam, the blockage is instantaneous, so the symptoms hit hard and fast, right from the very beginning. Now we absolutely have to talk about the TIA, or transient ischemic attack. You might hear it called a mini stroke. And it is so important to recognize. It's basically a temporary clog that the body manages to clear on its own so the symptoms go away. But a TIA is a massive, urgent warning sign that the conditions are perfect for a major permanent stroke to happen very soon. All right, so that's the clog. Now let's switch gears and look at the second major category, the hemorrhagic stroke, the burst pipe. And, while these are less common than ischemic strokes, they are often way more deadly. So what causes a pipe to burst? Well, the number one culprit is usually chronic high blood pressure. Just imagine years and years of high-pressure flow just pounding on the artery walls, weakening them over time until they finally give way and rupture. Other causes can be structural weaknesses, like an aneurysm, which is like a weak, ballooned-out spot on a vessel, or AVMs, which are these tangled, fragile messes of blood vessels that can easily burst. So we've gone through the mechanics of how these things happen. Now let's connect it all back to the real world. What things increase the risk of these events, and what do they actually look like in a patient? This is where it all comes together. And here's a huge one. A major risk factor for that embolic stroke we just talked about is a heart arrhythmia called atrial fibrillation. When the top chambers of the heart are beating chaotically like that, blood can pool and form clots. This increases the risk of one of those clots traveling to the brain by a staggering 3 to 5 times. That's a high-yield fact if I've ever heard one. In this list really drives home a key point. A lot of these risk factors are modifiable. I mean, we can't change our family history, but we can manage things like hypertension, which we know weakens blood vessels. We can manage diabetes, which speeds up that plaque buildup. We can stop smoking, which damages the lining of our arteries. These are all things we can influence. So what are the brain's alarm bells? Well, the exact symptoms depend entirely on what part of the brain is being damaged. That sudden one-sided paralysis, hemiplegia, is a classic sign of the motor cortex is affected. But a stroke could just as easily cause sudden vision loss, trouble speaking, or a profound sense of confusion. And this brings up a fundamental concept in neurology called contralateral control. It sounds complicated, but all it means is that the nerve pathways from our brain cross over to control the opposite side of the body. So for a clinician, seeing weakness on the right side of the body is a huge clue that the problem is in the left side of the brain. Look, understanding the why behind a stroke is absolutely essential for us in the medical field. But for everyone, recognizing the what, recognizing the signs of a stroke, is what empowers you to save a life. There's a saying in neurology, time is brain. For every single minute a stroke goes untreated, millions of brain cells are lost forever. Knowing the signs and acting fast, that can change everything.